Have you ever imagined controlling a computer or tech gadget with just your thoughts? Well, Elon Musk's Neuralink is turning this sci-fi dream into reality. In today's video, we dive into the exciting developments as Neuralink just announced that it has started recruiting for its first human trials of brain implants. Stick around to explore the technology, safety considerations, and what this means for the future of neurotechnology. So, what is Neuralink? Neuralink, founded in 2016 by Elon Musk and entrepreneur Bryan, is a pioneering neurotechnology company leading the charge in creating a brain-computer interface known as the Link. Their primary mission is to develop an advanced implantable device, acting as a vital link between the human brain and computers. Picture this: controlling computers, machines, or your environment with just your thoughts. Neuralink envisions turning this imagination into reality, allowing the human brain to directly communicate with external devices, unlocking a world of possibilities. Elon Musk, owner of Tesla and SpaceX, and Bryan, owner of the NBA's Sacramento Kings, founded Neuralink to unite the human brain with advanced technology, envisioning a better future. At the heart of Neuralink's brain-computer interface, or BCI, is the Link, a coin-sized brain chip. The Link is surgically placed beneath the skull in order to establish a connection with the brain through a delicate network of thin, flexible threads that are equipped with 1,024 electrodes. The goal? A seamless interaction between the human mind and the capabilities of advanced technology. Now, what's Neuralink's next ambitious step? Well, Neuralink is now inviting volunteers for a pivotal human trial, marking a significant advancement in connecting brains to computers. This trial hopes to empower individuals grappling with paralysis by offering them a chance to manage devices through a brain-computer interface, or BCI. Consider a person with limited physical mobility, such as someone with quadriplegia, gaining the ability to control a computer cursor or type on a keyboard solely through their thoughts. It's a technological breakthrough unlocking new avenues for accessibility. Neuralink's pursuit goes beyond experimentation. It's about enhancing the daily lives of those facing challenges due to physical limitations. This trial is a tangible step toward bridging the gap between human potential and technological innovation, illustrating how the fusion of brain and machine can redefine what's possible in the realm of assistive technology. Now, let's explore the science behind Neuralink. Neuralink's technology operates on principles similar to electrophysiology, a field that explores electrical signals within our nervous system. In our brains, neurons transmit signals during communication through synapses. To capture these signals, Neuralink employs electrodes or sensors, measuring voltage changes and neural spikes, indicating when neurons fire or are about to fire. This allows the recording of brain activity data not only during physical actions, but also when we merely think about performing them, effectively translating thoughts into actions. Despite the complexity of the recorded brain activity, Neuralink utilizes machine learning algorithms and other AI tools to decipher this wealth of information. Essentially, it involves training computers to comprehend our brain activity and understand our intentions. Imagine the transformative potential, such as instant access to vast knowledge and accelerated learning of new skills. Neuralink's technology envisions a paradigm shift in human intelligence and interaction with the world. Let's explore 5 applications of Neuralink that have substantial impact on millions of lives. Number 1. Helping people with disabilities. Neuralink's main goal is providing assistance to individuals grappling with significant motor challenges. The objective is to create a device enabling them to communicate and manipulate devices solely through their thoughts. This innovation holds particular promise for those dealing with conditions like tetraplegia, for example, where all 4 limbs are paralyzed. The device, functioning as a brain-computer interface, interprets thoughts into actions, potentially empowering individuals to operate computers or enhance communication efficiency. For example, individuals with paralysis could directly control a computer cursor or keyboard using the Neuralink device. The impact transcends mere convenience. It stands to markedly improve the quality of life for those contending with motor limitations, offering newfound independence and opportunities for enhanced communication and interaction with the world. Number 2. Visual prosthesis. Neuralink's second application is a visual prosthesis. offering hope for those with retinal injury or blindness due to eye trauma. The concept involves connecting a camera directly to the visual cortex and using an array of electrodes to generate a visual image. This technology aims to restore vision by bypassing damaged eye structures, providing a direct interface between the camera and the brain to recreate visual experiences. Number 3. Telepathy. Neuralink's third application is telepathy, a groundbreaking prospect where communication occurs directly through thoughts, eliminating the need for speech or writing. This technology aims to create a seamless exchange of ideas by interpreting and transmitting thoughts between individuals. Imagine sharing information effortlessly, bypassing traditional communication barriers. Neuralink's telepathic capabilities open up new possibilities for efficient and direct mental communication. Number 4. Enhancing human cognitive abilities. Neuralink's fourth application involves exploring brain-computer interfaces, or BCIs, to enhance human cognitive abilities. This means improving memory, attention, and problem-solving skills through direct connections between the brain and computers. Elon Musk refers to this use case of Neuralink as the Fitbit in your skull, with sensors comparable to those in a smartwatch. Just as a Fitbit tracks physical health, this link could assist in monitoring and enhancing our mental fitness, offering a unique approach to brain empowerment. Number 5. Treating health and mental conditions. Imagine a future where we can predict and address neurological conditions before they become a serious concern. Neuralink's link is more than just a fancy electrical signal reader. It dives deep into understanding the chemical signals in our brains. Neuralink's technology could become a game changer by identifying shifts in brain activity that could signal conditions like epilepsy, bipolar disorder, obsessive-compulsive disorder, Alzheimer's, or Parkinson's disease. But it doesn't stop there. These interfaces might also keep an eye on our mental well-being, offering help in cases of burnout, fatigue, anxiety, or depression. What makes Neuralink stand out is its holistic approach. For conditions that affect various parts of the brain, like anxiety and depression, the technology can precisely stimulate multiple areas with electrical signals. This means we might be looking at a new way to treat forms of depression or anxiety that were once thought to be untreatable. The potential of spotting and addressing neurological conditions early could reshape how we approach healthcare, bringing the idea of proactive care into the spotlight. Now, when we talk about this new tech, there are some important ethical and safety points to consider. Let's break them down. Number 1. Animal welfare. Neuralink has been testing its devices on animals like pigs and monkeys. People are rightly concerned about how these animals are treated during these experiments and worry about the potential harm caused by the invasive procedures. It's a critical aspect to weigh in exploring the impact of this technology. Number 2. Privacy and security. Concerns arise as Neuralink devices have the potential to access and transmit sensitive information from users' brains, encompassing thoughts, emotions, memories, and preferences. The handling of this data, its collection, storage, sharing, and protection against unauthorized access or misuse, prompts important questions about privacy and security. Number 3. Human dignity and autonomy. The impact of Neuralink devices on users' self-perception, identity, and various cognitive, emotional, and social aspects raises critical concerns. Questions emerge regarding how this technology may influence fundamental aspects of human dignity, autonomy, and individual rights. Number 4. Social justice and equity. Neuralink devices could contribute to emerging forms of inequality and discrimination while potentially exacerbating existing disparities. The central issue revolves around the accessibility and control of this technology, sparking concerns about its implications for the equitable distribution of power, resources, and opportunities in society. Now, to face all these challenges and concerns, Neuralink decided to tackle them head-on. Neuralink is currently in the process of recruiting human volunteers for a brain-computer interface designed to assist individuals with spinal cord injuries and ALS. However, this call for volunteers comes amidst concerning reports regarding the company's animal experiments, with documented issues ranging from infections to paralysis, brain swelling, and, in some instances, euthanasia. Critics have pointed out these ethical and safety concerns, emphasizing the need for thorough evaluation. And in fact, this is not the first time that Neuralink applies to move to the human trial phase. Previously, the FDA rejected Neuralink's application for human trials, expressing worries about electrode migration and device removal. Adding to the scrutiny, a medical ethics committee lodged a complaint with the SEC, alleging that Neuralink misled investors and potential patients regarding the development and safety of the device. The committee not only discouraged individuals from participating in Neuralink's trials, but also recommended the exploration of non-invasive alternatives for brain-computer interfaces. This situation underscores the importance of addressing ethical and safety considerations in the pursuit of cutting-edge medical technologies. In conclusion, Neuralink stands on the edge of revolutionizing human potential through brain-computer interfaces. Despite promising advancements, ethical considerations surrounding animal testing and data security linger. Navigating these concerns is pivotal to harnessing Neuralink's transformative power responsibly, ensuring a future where minds seamlessly integrate with technology, enhancing lives ethically and securely. What are your thoughts about Neuralink? Would you volunteer for human trials for different objectives if you were admissible? Let us know in the comments section below. And if you enjoyed this content, don't forget to hit that subscribe button for more captivating AI breakthroughs.